And with that, I want to invite up our morning keynote speaker, Mr. Chiang. Antony is the president of the Empire Health Foundation, and I just want to note that we have never allowed a major or event sponsor to be a keynote, because we are very sensitive. This is not a pay-to-play kind of thing. And so when we went to our convening panel this year and said, so here are some ideas around keynote speakers. What do you think of Dr. Robert Anda, leader, national leader? Oh, love that. That'd be great. What do you think about this? What do you think about that? Interesting. What do you think about hearing about the vision for healthcare in the Empire, from the Empire Health Foundation? And universally, among our convening panel, they said, we want to hear that story, because you got your fingers in so many different things. So thank you for coming. I appreciate it. Let's give Mr. Chiang a round of applause.
Thank you. Well, looks like we have an incredible mix of people here this morning. Thank you so much for this opportunity to come talk to you. I have just 3 sets of stories that I would like to share with you this morning, which go along with 3 themes that I'd like each of you hopefully to take away and hopefully be in your thoughts today during this conference as you see all these panels and other great speakers here today. And my first story, Garmin, where are you? Over there. So I was having coffee with Garmin, and he mentioned that he had just had breakfast with a good friend of his, Bryce. And as he and Bryce were chatting, he was talking about his daughter, Cindy, who's a teacher in Spokane Valley. Since she graduated college, she's been substitute teaching while waiting for a full-time classroom. And she turned 27. And she tried to pay the COBRA off her dad's employer plan for as long as possible. And she ended up having to stop because it ended up being 50% of her substitute teacher income. And so Garmin was chatting with Bryce and said, well, I think you should connect Cindy with Better Health Together. And for those of you who might not know, Better Health Together is our regional accountable community of health, if you haven't heard that phrase yet. And so sure enough, Cindy went off to the Better Health Together offices and got enrolled. And when I talked to her on Monday, just a couple days ago, she said she was incredibly grateful to have coverage, that she had been worried about it, and that now she was saving that money towards going to grad school. And I thought that was really great. And I think I saw him earlier in the lobby. Kurt, are you here? So Kurt was the IPA, in-person assister, sorry, a lot of acronyms here this morning, who actually helped enroll Cindy. And I also talked on Sunday with Maria. And Maria, she came to the country in, gosh, when she was 17. And I can't imagine starting a life over in another country when I was 17. I had the maturity of a 12-year-old. And she's now a citizen. And when she was here in Spokane, I think for the last 10 years or so, she was working as a caregiver in one of the home care agencies, as well as working at the graveyard shift as a nursing assistant at the NICU. And in the Great Recession that hit, she, along with many of her colleagues and coworkers, were laid off, unfortunately. So she started her own business. And it was a clean greening business. And today, several years later, she's doing much better. And she has a full load of clients. She works 60 hours a week, and our family's one of those clients. And but guess what? Do you think she had health insurance? No. And nobody in her family, her husband, 2 sons, nobody had health insurance. And so her son, Jesse, actually she told me on Sunday, hit a health issue 2 years ago and racked up over $6,000 in urgent care and ER medical bills. She actually ended up flying him to Mexico for treatment, and thankfully everything got resolved. But it was a fraction of the costs, including the travel and lodging costs, to do that. And so same thing happened. A family member said, hey, you really need to go see Allison at Better Health Together, made an appointment for her. And now the family's enrolled. Jesse is going to be finishing up his AA degree at Spokane Falls Community College in December. So a couple of real stories for our community of fathers, daughters, mothers, and sons who have been really positively impacted in the last 12 months. And so one of the things that I wanted to share these stories with you is to kind of just ask the question, you know, these are just 3 stories of deserving people who have been positively impacted. Not perfect people, but certainly deserving. And how many of those stories do you think we have in our region and in our neighborhoods? Hundreds? Thousands? Well, if you remember at this conference exactly a year ago, we were coming up on kind of a pretty momentous date. Anyone remember that date? October 1st, right, 2013. And so leading up to that date, there were a lot of folks in this region who were working and forming a collaboration that ended up becoming Better Health Together. And that collaboration ended up becoming part of the in-person assister network for the Health Benefit Exchange. And so Better Health Together, our regional accountable community of health, ended up signing a contract to enroll 10,000 hard-to-reach people in 14 counties, 13 of those rural, in eastern Washington, and eastern and central Washington. And here we are, almost exactly a year later, and to date, over 66,000 people who had not had coverage before are now insured. And so I'm just curious, in the room, if you are on the board of Better Health Together, or if you are on staff, would you please stand up? If you were part of Christine Barada in the county, first calling out to regional leaders to talk about how we could work together across policy and region, would you stand up? Maybe you still serve on the advisory committee or on the board for Better Health Together. If your organization, maybe it's a clinical setting, if you have an in-person assister that was trained as part of the network for Better Health Together, maybe you're a partner in the home health initiative, would you stand up as well? Fantastic. Well, would you just join me for just a second and give them a round of applause and help me? One of these things that I'm personally excited about is that the accountable communities of health in our state have enormous potential. And it's really more than just about coverage. And the caption there reads, "This patient has a rare form of medical insurance." Accountable communities of health in our state have an enormous opportunity to really be the bridge across multiple partners in a community to achieve the triple aim. And a couple just really quick examples. Here in our region, Accountable Community of Health organization is working on an ER diversion program with one of our regional healthcare organizations to divert oral pain patients out of the ER and into the proper dental care. And our target is a 50% reduction in that number of ER visits, inappropriate ER visits, so that we can bend, hopefully, the cost curve and achieve better outcomes for those patients. Another great example is there's a rural-based ACH on the west side that basically worked on a stroke protocol with all the clinical partners throughout a 5-county region. And their target was to radically improve the percentage of time that stroke patients within the first 60 minutes receive the best practice optimal amount of diagnosis and treatment. And you can see there from the graph that by the time the initiative first phase was over, they had increased the percentage of patients to 80% that had received the proper diagnosis and protocol within the first 60 minutes. So just think about the number of stroke victims and the better patient outcomes that resulted in that, both midterm and long term, in terms of bending the cost curve, as well as the quality of care that was delivered by those clinical settings. So why am I sharing each of these sets of stories? And it has to go with my first theme, which is whatever it is that you think about the Affordable Care Act, it is certainly causing change. And this is probably a once-in-a-career opportunity to have profound impact. So let's make the most of it. So that's my first theme. So now my second story, and for a few of you who've seen this story before, I have to admit it is my all-time favorite story, one of my all-time favorite stories. And in 2008, it's based here in Washington State, there's a young softball player. Her name is Sarah Tukolsky. And she's playing for Central Oregon University. And she is up against and stepping up to the plate versus Central Washington University. Now, these two universities are neck and neck in the conference, in the NCAA division that they're in, for the conference title. And right now the score is tied 0-0 when Sarah steps up to the plate. Now, Sarah is a good player, but she's pretty average, and she's never, ever in her career hit a home run, neither in high school nor in college. And as she steps up to the plate, she has the added pressure that there are two runners on base. Okay. So she takes the first pitch, and it's a strike. She resets and takes the second pitch. Pow! It's a line drive. It's going long, it's going hard, and it's a home run. Her first home run ever. I mean, the crowd is on their feet. Her teammates are on their feet. They're rushing home plate. The first runner comes in, scoring. The second runner comes in, scoring. And where's Sarah? As in her excitement, she was running, she completely missed first base. So she pivoted to go back and totally blew out her ACL in her knee. So she crumpled to the ground in agony, and then she literally, if you see, she crawled to first base and is lying there hugging the base in pain. So the coaches come out, the umps come out, the coach is like, can I substitute a runner for Sarah? And the umpire says, yes, you can, but I'll have to rule it a 2-run single and not a 3-run home run. He also rules that none of her teammates can help or touch her, or he'll have to call her out. In steps Mallory Holtman of the opposing team. Now, Mallory is not just a typical player, she is a rock star player. She not only holds the home run record for her university, she holds the home run record for the entire NCAA conference. She goes up to the ump and the coaches and says, excuse me, would it be okay if we carried her and let her touch each base? The coaches and the umps were shocked. No rule for the opposing team to touch the player. In fact, think about it, right? What does the opposing team want to do with the ball? Tag out the player, right? So Mallory and her teammate, Liz Wallace, give Sarah not just a handout, but they give Sarah a hand up. Let's watch this.
For that reason only, because she deserved it, Holtman and Wallace began to carry the injured Tucholsky, stopping to touch her left foot on each base as the three made their way around the diamond.
Character to step up and do the right thing at the right time.
It's emotional. You're proud. Be associated with those kids.
That's the first home run of the season for number 8, Sarah Tucholsky.
Fact is, I have a lot of respect for her and put her in high regards, her and her teammates. And, I can't thank her enough.
So why am I sharing? What? I love that story. I love that story. So why am I sharing it? Well, because it has a metaphor for why we're all here this morning. Sarah, the injured player, represents all of the people, all of the causes that we care about. And you, each of you, is Mallory, the equivalent of the star player, one of the best in your conference, whose values dictate that it's time to help. That it's not just about the wins and losses on the scorecard, and yes, those are important, but it's also about how you play the game in this game we call life. And that it's in these moments of decisions in each of our roles and professions and positions in which we can make a difference, in which, along with our partners, our teammates, we get to lock arms together and carry the Sarahs of this world from base to home plate to the home run that they deserve. And so I actually have a real-life example of this metaphor. Rock star players who are doing this in our region, and I'm going to embarrass a few of them. Their names are Elaine Couture at Providence, Lisa Brown at WSU, Mike Wilson, Tracy, who are partnering up with Empire Health Foundation to tackle a critical need in our community around the pipeline of primary care providers. And those partners have come together to form a consortium to try to tackle that need. And if you think about it, if you know anything about the pipeline of providers in our country, we're facing an incredible shortage. So think about, for just a minute, we just enrolled 66,000 people, right? And that's just incredible. It's fantastic. But does coverage mean meaningful access? It doesn't, right? And so for that pipeline, that shortage is only going to get worse. I was trying to look up some numbers for this talk, and I found one for 2010. So in 2010, 40% of active doctors are going to be 55 and older and retiring soon. That was 4 years ago, folks. So now that's 40% are 59 and older. I mean, when I read that, I was shocked, okay? So the pipeline is tough, and it's only going to get tougher. And so these rock stars in our community basically followed my theme number 2, which was to help lead in doing the right thing. And in forming the Spokane Teaching Health Center, our strategic plan is on target for growing the pipeline of primary care physicians being trained in our community by over 60% over the next 6 years. And pending things, little things like federal funding being renewed and a lot of other hiccups and challenges along the way. But if you can see there from that graph, for decades, that number has stayed stagnant and capped in our community. And now for the first time, thanks to these rock star players and these kind of partners, we have an opportunity as a community to really grow that pipeline. So I'm going to interrupt us here for just a second and ask everyone to stand up. Please stay standing if you were checking your smartphone during my talk rather than listening. No, I'm just kidding. Okay. Please stay standing if your name is Elaine or Lisa or Garmin or Mike or Tracy. If you are part of Providence, if you are part of WSU, if you are part or serve on the board of the consortium or help staff applying for the federal funding, please stay standing. Fantastic. Will you just, again, join me in a round of applause, thanking them for this great impact? So, overheard a quote from one of our new residents. We welcomed 6 new primary care residents to our community just a few months ago. Actually, you're my second patient, if you count that cadaver in med school. So, Empire Health Foundation is completely invested in this pipeline, and it's not just about graduate medical education or GME, it's also about undergraduate medical education or med school. And there's a little bit of a debate going on that you might have heard a few things about between a couple of our local educational institutions. And in terms of this little debate that's going on, you know, there's at least one easy way in which to decide the issue. But if we're not going to take the easy way out as a state, how should we be thinking about this as policymakers, as community partners, as clinical partners? These kinds of issues are never tough. So I'm always a big fan of let's go look at the data. And so these are from the Association of American Medical Colleges, these charts. And you can see there on the left, that's yet another scary chart about the growing shortage of physicians in our country. And then there on the right is the per capita of all 50 states of the number of physicians that we are training, UME, per capita in the country. And unfortunately, Washington State is dead last. And the only reason they don't show up dead last on the chart there is because they're also counting the numbers from the other 4 WWAMI states. But if you just did the 120 from Washington State, we would be dead last in the country. So think about that. We have 7 million people in Washington State, and we train 120 MDs every year. 120. And so if you're looking at that chart, and you can even see it from a distance, there's a green line in the middle that represents the average, okay, of all 50 states. And we are training less than 30% of the average. So we would have to more than triple the number of med students in our state just to get to mediocre. So, I know that this debate has been framed as this versus that. But when I look at this data, one thing is super clear to me, which is the debate can't be framed as this versus that. The debate has to be framed rather as this and that and that and that, even just to get to average. And so I don't know exactly what the right path is forward, but I do know it's not about supporting one versus the other. I think it's about supporting both the growth of WWAMI in a 2.0, a version 2.0, as well as supporting the growth of additional medical schools in our state. And I get it. Either or is always easier, right? The genius of the and is always harder than either or. But I'm confident and I believe that Washington State is up to the challenge of the genius of the and. And I should mention, again, why do we care so much? Why am I talking about this topic? Empire Health Foundation is the single largest investor actually in the WWAMI program, as well as a significant investor in WSU. And so we're right at the center and the heart of that debate. And we'd really like to see the genius of the and. Okay, so speaking of the genius of the and, Empire Health Foundation, as you might have noticed already from these first two sets of stories, really is all about collaboration and partnering and leveraging. And thankfully, and I'll just show you just a couple quick graphs, thanks to a number of opportunities that have come to fruition both nationally and at the state level and at locally, you can see there the growth in the amount of funds managed or governed by Empire Health Foundation. For the first couple of years, we directly managed about $1.8 million in direct grant making from our endowment. This year, it more than tripled to over $6 million. And by next year, it's projected or estimated that it will grow to over $15 million. And all of that are partnerships. One great example is a national funder based in the Midwest is partnering with Empire Health Foundation to re-grant and invest funds in our rural counties around rural aging. Just an example. And we have a lot of issues because of that craft that we're working on. So, for example, you'll hear later at lunchtime today from Rob Anda. Do not miss Rob. Rob is fantastic. He's talking about ACEs, adverse childhood experiences. We are huge investors regionally in ACEs. And for example, we partnered with our local one of our local K-12 districts at it's the second largest district in the state. And we partnered to try to tackle the out-of-school suspension rate at one of their largest high schools and one of their poorest high schools. And in 1 year, our partners reduced the out-of-school suspension rate by 35%. And so whether it's ACEs, rural aging, we work on obesity prevention, and a number of other issues, we're tackling a wide range of issues that we hope are getting upstream, right, of the delivery system that we're all here to talk about today. And then just really quickly, we have another initiative. We call it our seed fund. And it's kind of like a venture capital fund. And we pay for everything from grant writers to expert content, technical assistants, to financial analysts, sometimes just to buy breakfast and lunch for busy leaders to get together and work on what a partnership might look like. And in the last 3.5, 4 years, we've invested $650,000 in this seed fund. That has resulted in over $144 million in new funding to the state and to the region. And just as a show of comparison, in that same period, we directly granted from our endowment about $8 million. So a lot of great leverage and a lot of great collaboration with partners, because when all is said and done, the real work of the funding gets done by the partners. The brief collaboration between Alfred Nobel and Thomas Edison. And in case you don't know, Nobel of Nobel Prize fame, how he made his money? Dynamite. So, here is my last story, third and final story for the morning. And 7 years ago, my mom was diagnosed with cancer. That's a picture of her when she first came to the US before I was born to go to college. And she was diagnosed with non-small cell lung cancer, stage 4. And average life expectancy, 3, maybe 4 months. It turns out that there is a much higher percentage than expected of Asian American women who are postmenopausal who have non-small cell lung cancer. And researchers are still not entirely sure why. So it was a pretty dark chapter, and I remember a moment in the care facility where we were told maybe a week, maybe 2. And she received a targeted therapeutic that a very small percentage of these patients respond to. And in a very mixed blessing, she went into remission within days. Within days, she went from not being able to feed herself or use the bathroom or have a conversation to literally walking out of the facility. Tumors shrank, scans were clean. It was amazing. And yet, it didn't last. The cancer found new pathways to avoid the targeted receptors. The malignancies came back, they metastasized. There were terrible side effects from this therapeutic. It was a series of hospitals, clinics, specialists, procedures, operations. It was a long, long, very dark tunnel. But through and during that dark tunnel, there were nurses, caregivers, administrators, physicians, who shined a light not just with skill and intelligence, but most importantly, with compassion and caring. So please, for the rest of today, for the rest of this year, please don't ever forget that each of you are in a position to influence and impact how healthcare is delivered in our state and in our neighborhoods. It's a system that touches everybody at multiple chapters in their life. In fact, often the most critical chapters in our families' lives. That's a picture of my now 2-year-old Camille, just a day after she was born here in Spokane. So as you go throughout the rest of today, I hope you will take with you these 3 themes. That this is a unique time for profound impact, that we each, in our roles as staff, as executives, we can lead in doing the right thing and to do it with compassion. Thank you very much.
Antony, thank you very much. I want to leave you on the stage and then see if any of you would like to pepper him with a question or two. We've got folks at the back who can come forward who have a wireless handheld. So if you want to ask Antony a question, now's the time. Go ahead and raise your hand over there in the far corner.
Christine Clark from Healthcare for All Washington. From my personal knowledge, I want to remind you that there is an osteopathic physician school in Yakima who is also providing physician students staying in Washington State. Thank you.
Yeah, absolutely. I'm going to cycle back to that chart. So we definitely, the consortium has had several conversations with PNWU, primarily because if you think about it, if there's a shortage of residencies east of the Cascades, they're more impacted in many ways than, there it was. And so if you look at this chart, everything in red is DO, and everything in blue is MD. And so Washington State, we got a nice little bump up there in the red from PNWU, and they're an absolutely critical part of the pipeline. I mean, look at the leader in the country, West Virginia, half is coming from DA. Maine, all of their per capita is coming from DO. And we're absolutely partnering with him to add new primary care residencies anywhere east of the Cascades. Unfortunately, out of 1,600 residents training in Washington State, 1,500 of them are on the I-5 corridor. So 100 is all the other counties east of the Cascades. And so we're absolutely partnering with them. They're a critical part of the pipeline. So thanks for mentioning that.
Go ahead and raise your hand if you have another question or comment. In the middle over here.
Hi, I'm Linda Tiemann from the Washington Center for Nursing. We're the Workforce Center for Nursing for the state. And I'm curious, when you talk about primary care providers, where you factor in PAs and advanced nurse practitioners.
Yeah, fantastic question. And so one of the things, just for time limitations than anything else about the consortium that I didn't emphasize is the beautiful thing is that we are going to hopefully be building the consortium. We'll be partnering with WSU, who's building a new building on the campus. And if you think about WSU and the campus there on the river, it has the School of Nursing. They've shown leadership in moving up the School of Pharmacy. We have PT and OT from Eastern, the UW PA program, right? And so one of the opportunities in creating this new clinic, this new consortium, is to meaningfully shift the training grounds to truly being interprofessional. And so we absolutely, our clinical committee is Dean Butterfield from College of Nursing, right? It's, each of the deans of each of these critical parts of the allied health team. And we want them not only to experience that professionally after they get out, but to start when they're training right there on campus in serving. And that clinic will continue to serve, as it always has for 40 years, 35,000 of the most underserved patients in our region. And so it's a win for the community. It's a win for each of the important team members in team care, and it's a win for education. Uh-oh, okay, everyone. This is my board chair, and right now I'm very nervous.
Well, we've had this conversation a lot. I'm Sulani Madsen, and I'm a chair of the Empire Health Foundation Board. And I just want to end us on a cautionary note, because it is very easy to get focused on, look at the things that are working, but just like looking at the statistics on the workforce and what's coming up as a problem, and knowing that we have to face the problem in order to solve it, I just want to say that we need to also look at the stories of people who are not winners under the ACA changes. I was been forced out of the healthcare market. I don't have health insurance anymore for the first time in 30-some years. There are reasons why that's true, and there are reasons why that's true for people who, like me, are self-employed or have certain kinds of profiles, rural particularly. And so we need to look at those reasons why where is it not working, or we can't fix it.
Yeah, we've had so many great conversations about this, and I was on the panel at lunch last year, and I was like, okay, any board members in the room, please close your ears. I'm an incredible, champion for universal health care, but I have to admit, I think the ACA has enormous flaws. And and then I was like, okay, you can, start listening again. And I think there's no question that especially that negative impact in terms of winners and losers on the ACA has disproportionately hit, I would say, two categories. One category is rural, and it was better designed for urban metro regions and patients and delivery systems in the urban regions than it is in the rural regions. And the second category that I've seen a lot of negative data on has been around small businesses, right? 1 to, let's call it 50 or so people, especially the 1 to 10 category. I've heard, in fact, my prior board chairs, sharing me some stories about how what formerly available options there were to those employers are no longer available, and hopefully Ron Sims, who you'll hear at the end of today from the HBE, will kind of address some of those challenges that we're seeing from the ACA, at least on the plan and the coverage side, but it's impacting, in fact, in the delivery system as well. So definitely a critical dialogue, and is this being recorded, DJ? No.
Yes, it is.
Unfortunately, I'll be on tape that I think the ACA has significant flaws. But again, it's causing change, and so let's make the most of that change.
Well, thanks, Antony. Let's give him a round of applause.